I think because I do quite a lot of the questionnaires, the family and friends questionnaires, I think people are really like being asked about how they think their services are doing. I'm not sure how much people understand about how much they can really alter or change, and I think it's just an awareness raising issue that people have got some kind of say in how their local practice is meeting their needs, really. And I think that, I think so having local people involved, or people who are patients, should be quite an important thing to actually raise that, to make sure it's meeting local needs.
I would imagine quite vital. Well, especially these days with the surgeries being stretched, if there's a way that could alleviate the workload, I guess, of the doctors and the healthcare providers, it can only be good.
I think patient groups and GP surgeries are obviously a great help, because you can give your feedback. They can feedback for any suggestions that the surgery might want to do in the surgery to helpful. Maybe get a dietitian in once a month to help your diet, or things like that. Silly things is always helpful. So the GPs know what their patients would like.
I think patient groups, GP surgeries are extremely important, and speaking as the mother of a GP, I know how important it is to have the support of the patient body, to have somebody to actually bounce ideas off both ways round. And I think it's, in these days of NHS cuts, etc., when I think medical people are sometimes unfairly judged for not delivering what the general public think they should deliver, simply because of lack of money from the government, etc. I think it's important that patient groups get more of an inside view of what's going on within medical services, and therefore might have more sympathy when things perhaps aren't as good as they might like them to.
Would be very good. I've never been involved with one. I know they raise funds for helping the services, which they shouldn't have to, but they do. But I've no idea how important. I guess the health service would know. I've never been involved.
Not ever having used one, but I can imagine that they would be very informative.
As you can see, we've raised a lot of money, and this provided a list of quite a number of bits of kit for the doctors to make diagnostic tests easier, and also to prevent the need for patients to go to other places for some diagnostics.
Patient participation groups really are important, because we can suggest things to the surgery that perhaps when you're working really closely with something you don't actually see yourself, and also it gives the GPs time off that we can organise events like this, whereas if it's somebody at surgery organising it, then they're taking it away from another job that's most important.
Our patient group is very important. We've always done patient satisfaction questionnaires and things like that, which give us some feedback. But from having the patient participation group gives you feedback in a different way, in that it allows you to make changes in a positive way, and I think it gives a route for people to have an input into the services that we provide. So obviously there are limitations on it in terms of people want us to provide more and more and more, and we can't necessarily do that, but as a way of influencing our services, I think it's really helpful. We've made some good changes with their recommendations in mind, and I think it's been a very helpful thing over the last few years. Yeah.